Testimony resumed today in the murder trial of former Mount-Carmel Dr. William Husel. This morning, jurors heard for the first time from two nurses who administered large doses of fentanyl to Husel's patients. Chief Investigative Reporter Bennett Haverly joins us live from the Franklin County Courthouse. Bennett.
Tracy, this is a continuation of prosecution witnesses. Over the past several days, the prosecutors have called physician after physician who've testified about how they used lower doses of alternative pain medications when removing breathing tubes from critically ill or dying patients. This morning, it was two nurses who testified about how they administered doses of fentanyl ordered by Dr. Husel, and they explained their reasoning at the time. Dr. Husel is accused of 14 counts of murder. He's on trial for overprescribing those medications to his patients. His attorneys have said that he was providing comfort care to the patients to prevent them from suffering or enduring what they've called a bad death. This morning, prosecutors asked about pain scores that the nurses charted in the patient's records, including patient Ryan Hayes, who went from being comatose in the hospital to having a pain score of 0 to having a pain score of 10 around the time his breathing tube and ventilator were removed. When asked by the prosecutor, Nurse Tyler Springer said he was unaware that a nurse had already given patient Ryan Hayes 1,000 micrograms of fentanyl along with doses of Dilaudid and Versed. Springer says another nurse had already removed that patient's breathing tube when another dose of 1,000 micrograms of fentanyl and other drugs were given to him.
Actually, we put the order in, overrode, and then I got the medication out and went and administered to the patient.
To Mr. Hayes?
Yes.
Was Mr. Hayes already extubated at this time?
Yes.
So that was done prior to you arriving in the room?
Yes.
Was there any family there at that point?
I believe the son was there.
And you said you got the order. Who did you get the order from?
Dr. Husel.
Well, the defense has countered by asking that nurse about why he entered those pain scores. He talked about what he was taught during nursing school and said that he didn't want the patient to suffer, that his intent was comfort care. The defense also pointed out other life-saving measures that they say Dr. Husel performed on some of these same patients prior to when their breathing tubes were removed. Coming up tonight, 5 at 6, we're going to have more on what happened to these nurses after the scandal broke. That's tonight. Reporting live from inside the courthouse, Bennett Haverly, 10 TV News.